Before the third phase of vaccination aimed at vaccinating all above the age of 18, Delhi Chief Minister Arvind Kejriwal has urged people not to queue up at vaccination centers for the next 2 days because of unavailability of jabs. He's also said that vaccine makers have assured that vaccines will be made available over the next 48 hours. He's also said that the government's aim is to vaccinate the entire population of Delhi over the next 3 months. BJP-ruled states have also raised concerns over non-availability of vaccines. Uttar Pradesh has of now said there are no vaccine stocks to vaccinate people in the third phase of the vaccination. The state has placed an order for about 1 crore jabs, but they haven't received them just as yet. A similar concern has been raised by Gujarat, Himachal Pradesh, Karnataka, Telangana and Bihar. Gujarat and Bihar governments have said there may be a problem with the vaccine on the 1st of May, but the drive will be resumed in full force from the 15th of May. Himachal Pradesh government has also said that the fresh drive will start once vaccine supply is normal.
हमें उम्मीद है कि कल या परसों तक वैक्सीन आ जाएगी, उन्होंने भरोसा दिलाया है। मेरी आप सब लोगों से निवेदन है कि अभी कल आप सेंटरों पे लाइन में मत लगिएगा, कभी उसकी वजह से कानून व्यवस्था ना गड़बड़ा जाए, कहीं ऐसा ना हो कि सोशल डिस्टेंसिंग ख़राब हो जाए, भीड़ लग जाए, अभी वो सब मत करिएगा। जल्दबाजी मत कीजिएगा, सबको लगाएंगे वैक्सीन, उसकी पूरी तैयारी की हुई है, सबको वैक्सीन लगाएंगे, लेकिन आपका सहयोग चाहिए। ये ना हो कि कल से आप लाइनों में लगे, कल से अभी वैक्सीन अभी उपलब्ध नहीं है, उम्मीद है कि कल या परसों तक आ जाएगी। हमारे पूरे प्रयास हैं कि अगले 3 महीने के अंदर दिल्ली के सब लोगों को हम टीका लगा दें, सभी लोगों को वैक्सीनेट कर दें। 3 महीने का हमने टारगेट लिया है।
We have made orders from the state government to Serum Institute at Pune for about more than 1 crore doses. But the official news is that they are still not prepared to give it to us from tomorrow as it was scheduled. So that is why we are requesting the people of Karnataka, especially those who are above 18 years up to 44 years, to refrain from going to the hospitals thinking that you may be vaccinated tomorrow.
हमारा पास डेली 10 लाख डोसेस देने का कैपेसिटी है, 10 लाख कैपेसिटी है। मगर कितना अंदाज़ा मिलता, वो हिसाब से प्लानिंग करेंगे। मगर अभी तक 1.65, 1.7 तक भी वैक्सीन करे थे, 2 लाख 3 लाख भी कर सकते, वो कैसा मिलेगा वो हिसाब से करेंगे। कब से करना भी हमारा हाथ को आने के बाद, वैक्सीन हमारा हाथ को आने के बाद, वैक्सीन का शेड्यूल रिलीज़ होने के बाद, पूरा हमारा को समाचार मिलने के बाद, हमारा कॉन्फिडेंस बढ़ने के बाद शुरू करेंगे।
सर, जिस तरीके से लगातार बात हो रही है वैक्सीन की अवेलेबिलिटी, सप्लाई, उसको कैसे सुनिश्चित किया जाएगा? 1 मई को लेकर के किस तरीके से तैयारी है?
अब हम लोग ने पहले 50 लाख का हम लोग ने ऑर्डर सभी दोनों वैक्सीन प्रोड्यूसर को दिया हुआ है। उसके बाद हमने अभी कल शाम को डिसाइड किया था समिति के आधार पर कि हमने केंद्रीय स्वास्थ्य मंत्री को भी लिखा है कि हमको वैक्सीन उपलब्ध कराए। भारत सरकार को इस आशय के साथ लिखा है कि या तो वो हमको डोज दिलवा दे या कहीं से भी दिलवा दे, क्योंकि 1 तारीख प्रधानमंत्री जी ने इसका ऐलान किया है, तो इसलिए इसको हम लोग चाहते हैं कि इसको 1 तारीख को प्रारंभ करें। तो फिलहाल तो कई जगह हम लोग निकाला, ग्लोबल टेंडर भी हमने निकाला है, आज निकल गया होगा, और अभी हमारे पास कोई इस तरह का स्टॉक नहीं है अभी फिलहाल।
क्या स्थिति है आपके राज्य को? क्या 1 तारीख से आपके यहाँ जो यंगर आबादी है उसकी वैक्सीनेशन की प्रक्रिया शुरू हो पाएगी?
आज पूरे देश में यदि दो इंस्टीट्यूट यदि वैक्सीन उत्पादन कर रहे हैं, इसकी क्षमता लगभग 24 लाख है प्रतिदिन, जहां तक कि जो मेरी जानकारी हो सकता है गलत हो, लेकिन 24 लाख के आसपास है। और जब ये 70% आबादी का आप वैक्सीनेट करने जा रहे हैं, तो उस हिसाब से आपकी तैयारी होनी थी। और जब प्रधानमंत्री जी घोषणा की तो हम लोगों को विश्वास करने का कोई सवाल नहीं था, लेकिन जो अब स्थिति दिखाई दे रही है कि अब राज्यों को करना है, तो राज्यों को करना है, तो हमने तत्काल फिर 25 लाख भारत बायोटेक को दिया और 25 लाख सीरम इंस्टीट्यूट को दिया। भारत जो कंपनी है, बायोलैब है, उन्होंने कहा कि हम इसको जुलाई तक ही दे पाएंगे, जुलाई आखिरी तक ही दे पाएंगे। मई में वो लगभग 3 लाख देंगे बोल रहे हैं, फिर जून में कुछ लाख देंगे, फिर जुलाई के आखिरी तक हम दे पाएंगे। तो ये 3 लाख लेके जो हम तो एक ही दिन में लगा सकते हैं उस डोज को, तो फिर बचत का क्या होगा? और अभी तक के जो सीरम इंस्टीट्यूट है उसकी तरफ से कोई जवाब नहीं आया है। तो जब 50 लाख की डिमांड है, उसकी पूर्ति नहीं हो पा रही है, तो फिर ये 1 तारीख को कैसे शुरू होगा? और जब प्रधानमंत्री के द्वारा जब घोषणा कराया गया, प्रधानमंत्री जो घोषणा की, तो भारत सरकार के बैठे हुए अधिकारियों की इसकी तैयारी कर लेनी थी, जो कि नहीं कर पाए। ये बड़ा दुर्भाग्यजनक है कि 1 मई को कहीं किसी राज्य में शुरू नहीं हो पाएगा। यदि टोकन के रूप में शुरू भी कर देंगे तो उसका कोई औचित्य नहीं रहता, क्योंकि आपके पास वैक्सीन उपलब्ध ही नहीं है।
India Today's Aishwarya Paliwal now joins us for more on this big story. Aishwarya, will it then just be a token drive that begins tomorrow with states saying that they don't have stocks, whether it's an opposition ruled state or even BJP ruled states like Uttar Pradesh and Karnataka?
Yes, Gaurav, definitely what we will see tomorrow will just be the token beginning of the massive inoculation drive, because most of the states, and it's not just opposition states, even states which are ruled by the Bharatiya Janata Party, most of the chief minister are now asking people not to queue outside vaccination centers because they don't have enough doses. Now the question still remains, Gaurav, how many doses will it take and how many days will it take for those doses to reach those states? But when we talk about the national capital, Chief Minister Arvind Kejriwal has requested the citizens not to go outside the vaccination centers because he's very clearly saying we don't have the required doses. However, he has given citizens an assurance in the next 3 months, every citizen above the age of 18 will be vaccinated, but the drive will take some time. Gaurav.
Stay with me for a moment. Let's now take a look at the numbers that we're looking at in terms of vaccination status. Maharashtra, for example, they've received 1,63,62,470 doses. They've consumed 1,56,12,510. The reported wastage is 0.22%. Uttar Pradesh, for example, again has received 1,37,96,780 doses. They've consumed 1,26,16,121. Reported wastage is about 3.54%. Rajasthan has received 1,36,12,360 doses. They've consumed 1,32,42,014 and their reported wastage is 3.2%. Delhi received 38,40,710 doses and they've consumed, of those 38 lakhs, 32,77,716. Wastage reported is about 3.96%. Madhya Pradesh has received 89,24,720 doses and they've consumed 83,39,444. Wastage about 3.2%. Andhra Pradesh has received about 65,30,920 doses. They've consumed 63,42,743 and wastage is 0.95%. Tamil Nadu received 65,28,950 doses. They've consumed 62,97,671. About 8% wastage, 8.83% wastage reported. Kerala, 72,22,790 doses received, 71,44,122 consumed. Wastage is about 4.36%. Bihar received about 79,50,970 doses. They've consumed 71,14,687. Wastage is about 4.95%. Karnataka received 98,47,900 doses and have consumed 92,90,551. The wastage is about 0.14. If we were to talk about Bengal, they've received 1,13,83,340 doses and consumed 1,08,89,069. The wastage is about 2.36%. Gujarat received about 1,29,69,330 doses. They've consumed 1,25,06,342. Wastage is 3.6%, and this is as on the 29th of April. And amidst this massive COVID surge, the Supreme Court also took up the matter. Suo moto cognizance, and they've posed a series of questions to the centre. The Supreme Court pulled up the centre over oxygen shortage and allocation to the national capital, asking why is the national capital that's been allocated 490 metric tons with a revised requirement on the 20th of April as on 700 metric tons, receiving much lesser than demand. Supreme Court went on to ask whether the centre has any responsibility towards the citizens of Delhi and if it's being fulfilled. The Supreme Court questioned the rationale for different pricing of vaccines, the prices at which the vaccine is being sold to the centre, to states and to private hospitals, asking the centre to explain why vaccines were priced differently for different stakeholders. The Supreme Court warned against any kind of clampdown on information. The Supreme Court said if any citizen is being harassed or any citizen is making a plea on social media wanting either oxygen or beds, how can there be a clampdown on this request? And if there is a clampdown, it will be treated as contempt of court. And as COVID cases continue to spiral across the country, Prime Minister Narendra Modi is holding a high-level meeting of the Union Council of Ministers to discuss the situation and the road ahead. The cabinet meeting is being held virtually to discuss strategies to combat the massive surge, as the country has recorded over 3 lakh cases in the past 7 days every day. Discussions are also expected on efforts to boost oxygen supply across the country. Now, besides meeting chief ministers virtually, the Prime Minister has also held a series of meetings with pharma giants, with oxygen suppliers, with the 3 service chiefs and the Chief of Defence Staff on the national effort to combat the coronavirus. And the overall numbers in our country continue to remain a cause for serious concern. Now, if we were to talk about active cases in our country, 31,70,228 are active cases and 2,08,330 people have so far lost their lives. The recovery, of course, is much better, much higher, with 1,53,84,418 people having recovered successfully from COVID-19. When the world needed help last year in the first phase of COVID-19, India came forward and helped countries across the world. Now, countries from across the world are coming forward to help India battle this second wave. India received the first shipment of emergency relief from the United States of America, and this shipment includes 440 oxygen cylinders and regulators. This comes at a time when the Biden administration said that essential medical supplies worth more than $100 million will be delivered to India as quickly as possible. Japan has also initiated to send 300 oxygen concentrators and 300 ventilators to India as quickly as possible. Russia has sent 2 aircraft load of medical supplies having more than 22 tons of humanitarian aid, including 20 units of oxygen producing equipment, 75 artificial lung ventilation devices, 150 medical monitors and 2 lakh packages of essential medicines. More than 250 oxygen cylinders have also been ferried by Singapore using their Air Force C-130J Hercules transport aircraft. Dubai has sent 12 empty cryogenic containers which will be used to store and transport liquid oxygen. Bangkok has sent aid to India amidst this corona crisis. The Prime Minister met the Chief of Defence Staff and the 3 services chiefs, and the armed forces have been asked to help in whichever way they can, whether centre requires that help or states. Punjab's Chief Minister, Captain Amrinder Singh, a veteran himself, reached out to Indian Army's Western Command at Chandi Mandir to ask the armed forces to aid the civil administration to help revive a defunct industrial oxygen plant. The army is now also working at the Bhakra Dam. The army is also chipping in with medical infrastructure and is providing paramedics. The army is also setting up several field hospitals that may be required in an emergency. India Today's Kamaljeet Kaur Sandhu brings us this report.
Indian Army working diligently at Bhakra Nangal. These men in uniform are combat engineers and electrical mechanical engineers. A special army task force on work at a defunct oxygen plant after Punjab Chief Minister Amrinder Singh sounds an SOS over scarcity of precious air.
We are working on it with the engineers of the Bhakra Byas management. The equipment is very old and it is being replaced. So we hope that in about a week's time, this plant, if it is repaired, could start producing the oxygen.
If this turns out to be a success story, the Western Command could be looking at reviving at least half a dozen more oxygen plants at a short notice. Some of these plants are as old as 20 years. Army is also helping states like Himachal, Haryana and Delhi.
The government of Haryana approached Western Command, and the Western Command headquarters have detailed again a field hospital and ADS, a field brick, to move to Faridabad, where there are a lot of cases which are coming up. And later in Panipat, where the DRDO is going to make a 500-bedded hospital.
Army's efforts come in the wake of Army Chief General Naravane meeting and appraising Prime Minister Modi on its COVID crisis management. Significantly, Army is setting up temporary hospitals in various parts of the country.
Indian Army has proved time and again that they can be relied on at any time of crisis. Not only is the Indian Army vigilant at the borders, but they are also helping in terms of calamity. Now when there is a health crisis, the Indian Army is helping the people of the country fight the COVID war. And this is a war they're determined to win. But right now, it is the crisis management, and Indian Army's support to civil administration comes at a timely opportunity. With camera person Sachin Chandok, this is Kamaljeet Sandhu in Mohali, Punjab for India Today.
And in different parts of the country, there is a crisis of oxygen. The authorities are now taking steps to ensure that supply logistics is improved. India Today's Ashutosh Mishra is on board one such oxygen express, and this train is traveling from Lucknow to Varanasi. He brings us this special report.
This is not a regular train. This is Oxygen Express. And India Today is on board this life-saving lifeline.
When India battles against this pandemic, the Indian Railway is on mega mission to supply oxygen to several states. I'm on board on this Oxygen Express from Lucknow to Bokaro. Millions of lives will be saved through these Oxygen Express.
The train is on a 17-hour journey from Lucknow to Bokaro via Varanasi to refill oxygen tankers.
ये अनुभव क्या अब हमारे देश पे संकट है जो महामारी है हम लोग उस पक्ष में काम कर रहे हैं और हम लोग ये रेल एक सिस्टम है ये 24 घंटे काम करती है न रुकती है न थकती है इसलिए हम लोग लगे हुए हैं देश हित में काम हो रहा है भाई किसी की जान न जाए और हम लोग जितनी हेल्प कर सकते हैं उतनी करेंगे।
पहले ही जब संक्रमण फैल रहा है तो आप लोगों को भी डर होता है कभी कहां पर इस तरह से खतरा कहां से लेकर के आ जाए?
जी बिल्कुल रहता है हम लोग ऐसी हमारी जो है फ्रंट पे हम लोग रहते हैं स्टेशन पे रहते हैं यात्री आते हैं कहां से लोग आते हैं हम लोगों को पता तो रहता नहीं कौन संक्रमित है कौन नहीं है फिर भी हम लोगों को काम तो करना पड़ता है ना।
Meet these COVID heroes, the braves who are driving these oxygen trucks to its final destination. They are on a mission to save lives.
तो उनको आप बताते हैं कि आप उस ऑक्सीजन एक्सप्रेस में जा रहे हैं जो लाखों लोगों की जिंदगी बचा रही है।
जी बताते हैं जी। तो वो लोग भी यही कहते हैं चलो आप लोग खुद के मतलब देश की सेवा मतलब कर रहे हैं तो इसलिए वो ज़्यादा वो नहीं करते हैं। ये तो डर तो रहता है माहौल ऐसा चल रहा है तो लोग अपनी जान बचाना मुश्किल हो रहा है तो इससे पहले थोड़ा सा डर तो रहता ही है नहीं तभी कह रहे हैं कि आप लोग काम कर रहे हो कोई बात नहीं।
The train's guard is a proud man, calling this special duty a once-in-a-lifetime honor.
ये हमारा तो पहला ट्रिप है आपको सही बताएं हमारे मन से था कि मैं मेरी ड्यूटी जो है एक बार जरूर जो है ऑक्सीजन स्पेशल में लगता है।
और आज आपकी ख्वाहिश पूरी?
हमारी ख्वाहिश पूरी हो गई। ये बड़ा सौभाग्य रहा कि जो है हमें ये ट्रेन मिली और जो है हम अपनी ड्यूटी आराम से जो है पूर्णतः करते हुए।
Security personnel on board this special express are ensuring that there is no delay or bottlenecks for this special mission.
ये मिशन बहुत बड़ा है। ये जो है एक मानवता के लिए मिशन है। ये ऑक्सीजन जो हमारे लखनऊ में जो और आसपास के जनपदों में जो ऑक्सीजन खत्म हो रही है उस ऑक्सीजन की पूर्ति के लिए ये मिशन चलाया जा रहा है।
जीवन में आपको अपनी ड्यूटी में ये हिस्सा कितना याद रहेगा कि आप ऑक्सीजन एक्सप्रेस की हिफाजत के लिए गए थे और आप लोगों के लिए ऑक्सीजन लेकर के आए थे?
जीवन में तो यह हिस्सा हमेशा याद रहेगा कि एक समय था कि हम लोगों की जो है भलाई के लिए या मानवता के लिए जो है हम ऑक्सीजन एक्सप्रेस लेके गए थे और वहाँ से सकुशल लेके आए।
The train reaches Varanasi Junction on its way to Bokaro, but the mission continues to ensure people are not gasping for breath.
7 hours long journey on this oxygen express. I now deboard this train at Varanasi Junction. The journey of this express will continue, where the giant tankers will be taken to Bokaro at the refill plant, which will carry the liquid oxygen, which will save many lives who are battling against this COVID pandemic. Bringing you this ground report from onboard Oxygen Express between Lucknow to Varanasi with Sanjay Kumar. This is Ashutosh Mishra reporting for India Today.
So how does this work? The effort is to reduce the travel time. It could be 10 days or 12 days if both sides are by road. So what the government has done is they're using Indian Air Force C-17 Globemaster aircraft. The empty oxygen tankers or cryogenic tankers, they're airlifted one way to the nearest oxygen filling plant. That happens in a couple of hours. So 5 days time saved. Once those tankers are filled, if they come by road, it takes about 3 days or maybe 4 days. If they come by train, it's overnight. So then they're sent by these special oxygen trains. The effort is to reduce the time and try and save as many lives as possible. Another thing that seems to work in some cases, even if it's as a stopgap arrangement, it is the oxygen concentrators. And India requires a large number of oxygen concentrators at this point of time. And whether it's Singapore, Russia, the United States, Germany, Japan, many countries are coming forward to provide oxygen concentrators to India. Once they are flown in at the Indira Gandhi International Airport in the national capital, what then? Our report tells you how these oxygen concentrators are being sent to different locations.
When will they get the oxygen they so badly need? Patients gasping for oxygen, their families running from pillar to post to arrange the life-saving gas. To mitigate the crisis without losing any more time, the central government and states are procuring oxygen concentrators and cylinders from other countries. From Russia to America to China, various nations have extended a helping hand. The World Health Organization too is chartering flights to bring 4,000 oxygen concentrators to meet the huge demand in India. But how is India utilizing all this help that's flowing in? Let's break it down for you. Once the consignments arrive, an empowered committee in consultation with the Health Ministry distributes these supplies with the help of the Road and Transport Ministry. Most of them go to government-run hospitals. As per government data with India Today, it takes nearly a day with all speedy customs clearances for supplies to reach their destination. But at this time, some of the biggest hospitals, even in the national capital, like Ram Manohar Lohia and LNJP, still haven't received these life-saving consignments, which raises the big question, how fast is this equipment reaching precisely where it needs to go? The magnitude of the oxygen crisis means India will have to distribute these life-saving assets as swiftly as possible to limit the COVID surge. And there needs to be far greater transparency in just how quickly it can reach where it's needed the most. Bureau Report, India Today.
And every Indian is chipping in at this point of time. Every Indian. You've seen those train drivers. You've seen those pilots of the Indian Air Force. You've seen those truck drivers. Let me take you to an oxygen refilling plant. They're working round the clock. They're trying to ensure every Indian wants to chip in to ensure lives are saved.
India is a picture of despair at the moment. People are praying within hospital premises, serpentine queues at oxygen refilling plants. But despite the despair, there are COVID warriors who are giving their 100% to save lives. For 51-year-old Khushiram, there is no distinction between night and day for the last 10 days. He wakes up early morning to fill cylinders for ambulances and medical use. Later, he helps individuals who come with empty cylinders.
पहले अपने वो दूसरे काम में यूज होती, वैसे मेडिकल में जाती, वैसे लगती मरीजों के लाने, इतनी फालतू नहीं थी। जो हमारी वैसे सप्लाई थी वो बंद हो गई, अब मेडिकल लगा चल रहा केवल एम्बुलेंसों के लाने।
Khushiram is a native of Madhya Pradesh and has been staying on the premise because work cannot stop.
कभी नहीं सोचा था कि हवाई ऐसी इतनी कीमतदार हो जाएगी, ऐसी हो जाएगी, क्या होगा आगे का कोई पता नहीं, अब भी पता नहीं आगे का कोई। दुख तो लगता है मगर करूं क्या, जितना उपाय है उतना कर रहे।
Life is also tough for those who are working at these refilling plants. Most of them have been working for 20 hours straight so that they can meet the demand. A lot of them have been working in the industry for the past 15 years, but they have said they have never seen something like this. This is unprecedented crisis. A lot of them, in fact, have left their homes and they have started staying in these premises because they have to work continuously for 20 hours. The demand is such. They understand the duty they have on their shoulders. A lot of them working tell India Today that if they don't do their job, they understand someone's life will be lost.
35-year-old Pradeep Kumar hasn't seen his children for the past 1 year. A native of Chhattisgarh, he was supposed to meet his family in January this year, but the second wave changed everything. For Pradeep and Khushiram, life has taken an unusual turn. Day in, day out, they try to fill oxygen cylinders in the hope that their work will save someone's life. They are our unsung COVID warriors. With Aishwarya Paliwal, Bureau Report, India Today.
And this is what the nation needs to do.